Now for the latest facts in the coronavirus pandemic. The CDC released results from a recent survey that found nearly 41% of respondents have struggled with at least some form of mental health issue because of the pandemic. And New Zealand's Prime Minister Jacinda Ardern has extended a lockdown in the country's biggest city, Auckland, after the discovery of a new outbreak. This comes after the country had reported 0 locally transmitted cases for 102 straight days. Dr. Anthony Fauci joined actor Matthew McConaughey for a discussion on Instagram Live. McConaughey asked about herd immunity, the idea of just letting the virus spread unchecked. Fauci said the American public is simply not equipped for that. Take a listen.
If you look at the United States of America...
Is there any dissent from your top economic advisors in your decision to leave the guidelines in place until the end of April?
No, and this is before we heard the 2.2 million people.
With our epidemic of obesity, as it were.
This is before we heard the 2.2 million people.
With the number of people with hypertension.
Ride it. They say ride it like a cowboy.
With the number of people with diabetes.
Ride it. Ride that sucker right through.
If everyone got infected, the death toll would be enormous.
That's where the 2.2 million people come in.
And totally unacceptable.
I mean, we had a lot of people who were saying maybe we shouldn't do anything. Just ride it. They say ride it like a cowboy. Just ride it. Ride that sucker right through.
Now for the latest facts in the coronavirus pandemic. Joining me now is MSNBC senior medical contributor and a former Obama White House health policy advisor, Dr. Ezekiel Emanuel. He is now the vice provost of global initiatives at the University of Pennsylvania, author of the new book, Which Country Has the World's Best Health Care? Zeke, can you add more to what Dr. Fauci said?
Ride it. They say ride it like a cowboy. Just ride it. Ride that sucker right through. That's where the 2.2 million people come in.
Is that herd immunity? If you looked at it on in a spreadsheet, you might think is a good idea. Explain further why that would be a scary proposition for this country.
That's where the 2.2 million people come in. Would have died, maybe, but it would have been 1.6 to 2.2.
So the official numbers, we have about 5.3 million cases, about 170,000 deaths, but the real deaths are probably higher. We now have reports estimate over 200,000. Herd immunity will require 225 million Americans to be infected. And if you just multiply the numbers, you're going to have millions of deaths.
And that's not acceptable. But there were a lot of people that said, I thought about it. I said, maybe we should ride it through. You know, you always hear about the flu. I talk about it all the time. We had a bad flu season.
And that's just going to be unacceptable to people. Millions of deaths. You know, each year we have 2.8 million people who die, 75% of them over 65. But in this case, you would have millions of more people dying. It's just totally unacceptable.
Now, the virus that we're talking about having to do, you know, a lot of people think that goes away in April with the heat. As the heat comes in. Typically, one day it's like a miracle, it will disappear. And from our shores, it could get worse before it gets better. It could maybe go away. We'll see what happens. You have to be calm. It'll go away. It will go away. Just stay calm. It will go away. We need a little separation until such time as this goes away.
And we have a very high-risk population.
To go away, hopefully at the end of the month. And if not, it hopefully will be soon after that.
As Dr. Fauci said, the obese, the people with lung disease, people with heart disease, diabetics.
I said it's going away, and it is going away.
You were saying things like, I think it's a problem that's going to go away within a couple of days.
It will go away. I think what happens is it's going to go away. This is going to go away. It's going to go. It's going to leave. It's going to be gone. It's going to be eradicated. And it might take longer. It might be in smaller sections. It won't be what we had. I feel about vaccines like I feel about tests. This is going to go away without a vaccine. It's going to go away, and we're not going to see it again, hopefully, after a period of time. It'll go away at some point. It'll go away. It may flare up, and it may not flare up. We'll have to see what happens, but if it does flare up, we're going to put out the fire. I always say, even without it, it goes away. It's dying out.
It's fading away. It's going to fade away.
I think that at some point that's going to sort of just disappear, I hope.
Just way too many people at very high risk for this infection. So not a good idea.
I will be right eventually. You know, I said it's going to disappear. I'll say it again. But it's going to disappear. And I'll be right. Well, the virus will disappear. It will disappear. You know, I say it's going to disappear. They say, oh, that's terrible. You say, well, it's true. I mean, it's going to disappear.
My view is the school should open. This thing's going away. It will go away like things go away.
Now for the latest facts in the coronavirus pandemic. It seems like data is slowing again. Number of raw tests that we are doing go down. Is this related?
Go away, like things go away.
It's going away. No, it'll go.
How concerned are you about this testing method?
Things go away. Absolutely. It's no question in my mind. It will go away.
I am really concerned that we're dropping tests. We need to be getting up to 5 million tests a day, and we're stuck below 800,000 tests a day. That is unacceptable. I called up to find out what the testing is. You have to get a doctor to fax a requirement. Who's faxing in the 21st century? And it's a 72-hour turnaround. That's just unacceptable. It's not a very useful test at that point.
We had a lot of people were saying maybe we shouldn't do anything. Just ride it. They say ride it like a cowboy. Just ride it. Ride that sucker right through.
Big problem, the fact that we don't have the testing capacity and the supply chains for all the chemicals and things needed for the test have not been beefed up.
And that's not acceptable. But there were a lot of people that said, I thought about it. I said, maybe we should ride it through. You know, you always hear about the flu. I talk about it.
We have had 7 months to get ready for this.
But this is different. And part of this is the unknown. And part of it also is the viciousness of it.
And this administration still can't get testing under control. That just, I think, portends very badly for the idea that once we have a vaccine, we're actually going to get it to 300 million Americans shots in arms. It's just not, they're not ready. And they don't have the capacity to manage complex problems.
Just ride it. They say ride it like a cowboy. Just ride it. Ride that sucker right through. That's where the 2.2 million people come in. Would have died, maybe. But it would have been 1.6 to 2.2. And that's not acceptable. But there were a lot of people that said, I thought about it. I said, maybe we...
And New Zealand's Prime Minister Jacinda Ardern has extended a lockdown in the country's biggest city, Auckland, after the discovery of a new outbreak. This comes after the country had reported 0 locally transmitted cases for 102 straight days.